Transport work is a good example, and I'm afraid, Alex, you're spot on. We've lost 47 bus drivers due to this awful virus, 47 bereaved families, shop workers, police officers, teachers and support staff. And so, Alex, I have been lobbying the government that because of the occupations these people have, they are literally taking a risk with their lives when they go to work, and we need them to be working to keep our city going. So I'll continue to lobby the government, Alex, but just so you're clear, it's not a decision that I can take in relation to who gets the vaccines, but I will continue to lobby because I think it's really important they receive the vaccine as soon as possible.
How do you process that figure of deaths on buses? Because one of the first alarm bells to go off in this studio during this programme, these encounters that you have with our listeners, was about bus drivers. Who let them down?
Well, I've examined this very carefully for obvious personal reasons about whether we should have done more. And what I did was not content with us marking our own homework in relation to safety of our bus drivers and transport workers. I got somebody else to look into this, and I got Sir Michael Marmot and his team at the University College London. And one of the things I asked them to look into is what we're doing, although I'm told it's world leading, is that enough? There's some good news for us in relation to TfL, which is that they said, we've gone above and beyond what anybody else is doing around the world. A number of people have said this, but it's still the case. Too many people are dying. One of the things that they concluded was one of the reasons why people were catching the virus was because of community transmissions. The best thing that could have happened was lockdown sooner. But secondly, many of our bus drivers, I'm afraid, had underlying health issues, may live in overcrowded accommodation, things like respiratory issues, asthma or other issues, which means if they catch the virus, they're more likely to have more severe consequences. And that's why more of our bus drivers are shielding to avoid them being at risk. But we've taken huge steps to make sure not just our passengers, but our staff are safe, and will continue to do so. Not just follow the best advice, but lead the way, because 47 deaths is 47 too many.
It's 20 minutes after 10. Alex doesn't go away particularly encouraged. I presume he would have liked a date or a big fat yes.
On the vaccines, listen, Alex, if I was in charge of deciding who gets the vaccines, bus drivers would already be receiving them, as would police officers, teachers, support staff,
That's quite easy
workers.
to say that, isn't it?
Well, I'm not really sure. You can say, look, I'm lobbying the people in charge of giving out the vaccines. I've lobbied them as recently as yesterday. I lobbied them a few months ago. And I've said if I was in charge, I'd let them have it now. What answer would you like me to give, James?
What reason do they give you for not doing it now?
Because at the moment, the evidence they have is age is a better metrics for deciding risk. I think that's...
As opposed to exposure.
Exactly right.
Okay.
But to give them credit, this week you'll have seen the change where they have started to include issues around ethnicity, and there is some movement, and you'll remember because you talked about this, the issue of the 1.7 additional million people, and I think that's because they are moving, James. So I don't want to give the impression that I think they're dogmatic. I'm trying to make the move sooner because my concern is Alex is literally probably gone to work today as a bus driver. His family are keeping their fingers crossed and praying to God he doesn't catch the virus, and there are thousands of people like Alex driving buses, working in transport, thousands as police officers, thousands as teachers and support staff, and many thousands working in shops. I think they should be getting the vaccine because every minute they're working, they could potentially catch the risk. You and I can work safely from home or a COVID-secure studio, not in contact with the public. These people aren't.